Your residential treatment center is probably running on too many disconnected systems, and as of 2022, only about 29% of substance use treatment centers had fully implemented an EHR. A nationwide cross-sectional survey study found just 29% of substance use treatment centers had fully implemented an EHR as of 2022. Here is the software stack a residential addiction treatment center actually needs: clinical, admissions, and billing, viewed from the operator's chair. We cover the documentation, admissions, billing, and bed management pieces an effective behavioral health EHR should bring together. An EHR is the digital platform that replaces paper charts and centralizes patient information for your whole residential program. It puts counseling notes, treatment plans, and medication records in one place, so the multidisciplinary team works from one current record. Addiction treatment programs have unique requirements, so the system should be purpose-built or highly configurable for behavioral health and SUD treatment. When your systems don't talk to each other, staff end up doing double data entry and juggling separate apps, which is inefficient and causes errors. A lack of integration creates information silos and double data entry, which slow the team down and introduce mistakes. Residential programs bill on facility claims using UB04 forms, while outpatient uses professional CMS 1500 claims. The stack has to handle both correctly. Behave Health is an all-in-one platform combining electronic health records, CRM, and revenue cycle management in a single solution. Designed so a residential center runs most operations without separate systems. It manages clinical records, handles admissions and intake workflows, and integrates billing and claims, all in one platform. It is designed to include capabilities like scheduling, bed management for residential programs, and outcome tracking as part of the platform. Let's walk through the 4 layers an effective residential software stack should cover, from the front door to the final claim. Admissions, clinical documentation, billing and revenue cycle, and compliance. 4 layers, 1 connected system. Layer 1, admissions and intake. Managing admissions and intake workflows is often considered CRM functionality, and an all-in-one platform handles it inside the same system as the chart. You should be able to mirror your process, admission and orientation checklists, through to discharge and aftercare planning steps. Layer 2, clinical documentation built for residential care. Look for templates tailored to behavioral health, intake assessments, group therapy notes, treatment plans, progress notes, and discharge summaries. A flexible EHR supports program-specific workflows, such as a residential 30-day program track versus an intensive outpatient program. Layer 3, billing and revenue cycle management. Key billing features include insurance eligibility checks, authorization tracking, and claim scrubbing to catch issues before submission. When billing is connected to documentation, charting and billing happen in tandem, designed to reduce administrative lag and speed reimbursement. Layer 4, compliance and reporting. The system should be designed to support HIPAA and the 42 CFR Part 2 confidentiality rules directly, with encryption, role-based access, and audit logs. Reporting tools let administrators monitor outcomes, utilization, and performance, useful for quality improvement and reporting to funders. A residential center rarely stays only residential, and the source describes a platform built to follow clients across every level of care. Behave EHR is described as supporting all levels of care, from inpatient to residential to outpatient facilities, in one customer's words. It can also accommodate community-based programs like sober living and drug court, so clients stay in one system as they step down. Because it follows the full continuum, clients can be tracked from inpatient to aftercare with no loss of information. The biggest risk in a stack rollout is getting your team to adopt it. A common industry saying is that an EHR implementation is roughly 20% technology and 80% people. Treat the rollout as a change management project, not just a software install. Plan a gradual rollout and hands-on training. A user-friendly interface directly impacts documentation quality and adoption, which is why specialized behavioral health design matters. Behave Health was designed from the ground up for addiction treatment providers, with each workflow built for its specific purpose, rather than retrofitted from a general EHR. It is designed to handle the work a residential team does daily: drug testing, one-on-one and group notes, treatment plans, progress reviews, and bed management.
Its billing assistant is designed to guide clinicians to complete documentation, then pass that information to billing automatically.
It was among the first addiction treatment EHRs to integrate ChatGPT, designed to speed documentation and improve note quality. Stop running your residential center on disconnected systems. Book a 20-minute demo of the all-in-one stack at behavehealth.com. See EHR, CRM, RCM, and bed management for residential programs in one platform at behavehealth.com.